Ladies and gentlemen, or should I say, please take your seats and fasten your seat belts. So just to inform you that the Deputy Minister is here, and the Deputy Minister will be joining us soon as I speak. So good evening, everyone, and a hearty welcome to all of you. And just before we start our program for the evening, in the interest of health, I was asked to just remind everyone that at your table, there's a little sheet with the menu. If you can please make a choice of the main meal, the hotel staff will collect it and make sure that we get our dinner. So once again, good evening and welcome. I'm Andre Wagner, and I have been tasked to be the master of ceremonies at this event this evening. So I would like to start and just say that on behalf of the African Palliative Care Association, I'm thrilled to welcome each and every one of you to this special evening as we celebrate 20 years of dedicated service, impact, and unwavering commitment to our cause. Tonight we come together not only to reflect on the incredible journey that has brought us this milestone, but also to express our deepest gratitude to all those who have supported us along the way. Our passionate volunteers, dedicated staff, government departments, generous donors, and the national associations we serve. Over the past 2 decades, APCA has worked tirelessly to bring about positive change, to uplift the lives of those in need, and to champion the values of collaboration, respect, diversity, excellence, and quality. Together, we have overcome challenges, embraced opportunities, and we have forged lasting relationships that have strengthened our resolve and fueled our mission. And this evening, you will see testimony of that. As we look back on our achievements with pride, let us also look forward with hope and determination. The road ahead may be long, but with your continued support and unwavering dedication, we are confident that we can achieve even greater impact and make a difference in the lives of many more individuals and communities in years to come. So then tonight, let us celebrate not only the past 20 years of APCA's remarkable journey, but also the boundless possibilities that lie ahead. Thank you for being a part of this incredible legacy, and we are here for many more years to come. So then, ladies and gentlemen, without any further delay, I am going to ask the board chair of the African Palliative Care Association, Mrs. Tobekile Finger, to come and do welcome remarks. Thank you.
Good evening, everyone. What an exciting time for us to be there. I think for me specifically, someone asked me a rather odd question this morning and said, how old are you? I'm not understanding why you are celebrating 20 years of palliative care. I was fortunate enough to have been a student at the University of Free State, studying a Bachelor of Social Sciences. And one of the things that you needed to do was to do your 720 hours in terms of your practical work in psychology. And I was posted in a tiny hospice called Naledi Hospice. And that's where I met my passion for palliative care in the year 2000. It was a momentous occasion if I look back, and I fell into the hands of Joan Marston, that's sitting right at the back. That was a mentor at the time, and I've never looked back. And as we were sitting in the briefing room with the Deputy Minister, talking about palliative care, I said, if you wanted to know where CCMDD and external pickup points started from, it started from hospices in the year 2000 in Universitas Hospital, where we were already working with HIV patients that were supported by hospices. So CCMDD is not a new concept, is a concept that emanated from palliative care. That was my welcome, because I really wanted us to reflect on the impact that palliative care is making in South Africa and in other countries. And it's never limited to palliative care, it has to be integrated. Deputy Minister, welcome. We are honored to have you here. I think you've been a champion for palliative care even before you were the Deputy Minister. I think for me, the two icons in South Africa that have been rallying palliative care, it would be the Deputy Minister and our late Dr. Sifularo. Those who would know him, he was a champion in Northwest that was championing the work for palliative care. And the inroads that we see for now, it's because of him. Welcome, Deputy Minister. Welcome, Dr. Vilakazi from the National Department of Health. Prof from Stellenbosch, welcome. We are happy that you are here with us, the staff from the Deputy Minister's office, and to my Executive Director and the entire palliative care team, which is some of the board members that are here, Prof Ike, Dr. Zippy. I think if we can just stand the Board of Palliative Care just for the Deputy Minister to know the countries and the people that have been supporting Prof Renee. So these are the champions that have been working in palliative care and driving palliative care. Thank you so much. And I think I want all the champions in the room to stand, which is everyone in the rooms. I think everyone that's here has played a significant role. I think, Deputy Minister, we've got non-governmental organization, we've got universities that have played a critical role. We've got Usis Zodwa Sitole. I think those that knows Usis Zodwa, that's someone that even when she gets into a plane, she will talk about palliative care, even when there's no reason to talk about palliative care. I think today is recognizing each and every one that is in this room that has been playing an instrumental role, and there are so many people that are not here. To our MC, who's my former board chair, that I've taken this baton on, Andre Wagner. We do not underestimate the amount of work that you've done in this country. And today, all that we are here to do is to acknowledge and reflect the work that we've done, not only in South Africa, but across Africa. We have time limitation with regards to our Deputy Minister, and I've been working with his team, Mr. Nsibi and Utabanya, like, I am please asking, please don't let me down. The DM must be here. So DM, thank you to Gate. Thank you to Tabani. Thank you to Mr. Msibi. They've been making sure that regardless of how your schedule is changing, you are here. So we don't take that for granted. Andre, I think it's back to you so that we can let the Deputy Minister be able to do his work, but equally, we don't want to miss the keynote address. Thank you very much. I hope this is going to be a lovely evening that all of us take down to a memory lane in terms of the efforts and the achievements that we've done. Thank you.
Thank you very much, Toby. I just need to say that this past 20 years, when I saw the Deputy Minister coming into the room, I remembered our trip from South Africa to Uganda to a palliative care conference a few years ago, which formed part of the 20 years. And Prof, I miss those very amazing performances at the Artscape that I went to under your directorship when you were still doing that annual HIV event at the Artscape, which forms part of the 20 years as well. So I thank you for that. I now would like to introduce Dr. Khumotso Vilikazi, and I had to make sure that I get the title right. She is the National Viral Hepatitis and TB HIV STIs medical lead. And I had to breathe somewhere there. So, Dr. Vilakazi, I would like to welcome you to the stage to address our audience and then also to introduce the Deputy Minister for his keynote address. Thank you.
Thank you, Chair. I hope, some of us are vertically disadvantaged. Thank you for the invitation. And thinking about palliative care, I remember 20 years ago, whenever I heard the word palliative care, the only thing I could think about was death. As we know, in the early 2000s, when they said palliative care, it's like, yeah, no, you already put a cross against the name. So I'm not here to actually talk about myself, but to introduce one of the champions of palliative care in our country, the Honorable Deputy Minister, Dr. Brigadier General Sibongiseni Maxwell Dlomo. Dr. Dlomo was born in a serene part of KwaZulu-Natal, Umbumbulu, which is south of Durban. He began his illustrious career at Langezo High School and later enrolled at the University of Natal, which is also in Durban, where he excelled in the field of medicine. He later pursued studies and graduated for the Bachelor of Arts degree, majoring in psychology and sociology. And we know how much we have gained as a country from this achievement. In order to spearhead a holistic treatment and management of diseases, he then attained a master's degree in public health from the then Medical University of South Africa, now called Sefako Makgatho Health Sciences University. His passion for raising the quality of lives of ordinary people and his concern for addressing the pandemic of HIV and AIDS and TB motivated him to extend his professional understanding by equipping himself with a postgraduate diploma in HIV and AIDS management. He didn't just say, I'm a doctor, I've got other degrees. He continued to learn so that we can all gain from his knowledge and his achievements. He's a keen scholar with an insatiable appetite for acquiring knowledge. Today, he holds all those degrees that I mentioned. His humble contribution to the emancipation of the people of our country saw him joining the military wing of the then banned African National Congress, Umkhonto weSizwe, at a very young age. His activities in MK led to his incarceration in Robben Island in the 1980s. On his return, he served the people of Newcastle both as a mayor and as a medical practitioner, running his own practice. How I wish I was one of the patients. On his return, he served the people of, I said it already. He has also worked as an academic at the University of KwaZulu-Natal, lecturing in public health and advising the Vice Chancellor. Dr. Dlomo has also served in the South African National Defence Force, where he was bestowed a rank of a brigadier general. I don't know if we know what a brigadier general is. Do we? I see a lot of heads nodding in the opposite direction. You can talk to him later. He will explain more. From the army, just before he was elected to the KZN legislature, Dr. Dlomo joined the eThekwini Metro Municipality, where he served as a deputy city manager responsible for health and social services. Dr. Dlomo is an intellectual. I didn't read all his qualifications, but there are a lot. He's also a freedom fighter. He's a medical practitioner at heart, a former KZN provincial executive member, a former chairperson of the eThekwini region of the ANC, regional treasurer, Emalahleni, a former chairperson of the Health Portfolio Committee in Parliament, and a former provincial chairperson of the Men's Forum. And as we all know, today he's here in his capacity as our Honorable Deputy Minister of Health. Dr. Dlomo, the floor is yours.
Yeah, thank you very much, Khomos, and good evening to our program director, Mr. Andre Wagner, and all the delegates who are here. I must also greet Ms. Tobeka Finger, our African Palliative Care Association board chair, and all those members who serve with her. To Dr. Emmanuel, our executive director, all the way from Uganda. We have met several times. I still keep those photos that we took in Uganda. I have them framed, was it's a good reminder. To some of the colleagues, I'm aware I've logged in through a virtual platform. To all of you distinguished guests, ladies and gentlemen, with the professor who's supporting me, Emeritus Professor of Stellenbosch University, Professor Jan du Toit. Also, I met, and then we are doing some work because of his long-term relationship with issues of HIV and AIDS in our country. I see one of our professors who deserted us in KwaZulu-Natal and is now here in UCT, Professor Reed. Good evening, Professor Reed. And to my fellow members I worked with in this program in the country, I see Uzodo, and when I looked at Zodo, I asked immediately, where is Michelle? Because Michelle was almost our little troublemaker there. We'll discuss and discuss, and she will come in and say, where's an issue about pediatric palliative care? Now, she never forgot that. So I know she's an advocate of palliative care, but specifically, very specifically, pediatric one. So I'll remember that, Michelle, all the time. All our guests who are out from outside our country, I just want to indicate to you, there are two things I wanted to mention first. Part of it is not in my speech, but firstly, most of Vilakazi, thank you for the introduction, but we have an immediate task, which must go and discuss the DG. I've only got 12 days in government myself. You know how things are happening, and we are going through the process of elections. Hopefully I'm coming back. Then you have to, I'll give you 1 month to give me an answer, consulting the DG. Since the departure of those key members in the department who were actually championing palliative care, where are we now? Sadia Singh, and there's one other guy, Lawrence, who was helping us. I'll tell you why. It does not show an impact in the country, and if we have pockets of excellences in provinces, and yet at the center, there's nobody to hold that string. And therefore, do share that with the DG to say, within a month, you'll give me an answer. What is the process? These are problems, colleagues, in governments generally. And I've always said to myself, why do government officials remember their birthdays and do not remember that there's a contract with a particular date on end? And when someone is going to be exiting next month, then you should start the process much earlier. I can tell you this now. Professor Glenda Gray is going to be actually exiting as a CEO of South African Medical Research Council next month. A new CEO is already in place as early as January. So that CEO can, in his or her spare time, find time to meet with Professor Glenda and visit the MRC and say, what are the things happening here? How are things? So that when that new CEO comes in, it's just a smooth takeover. But we wait, knowing that someday this date is going to come to the department, to a government institution of an expiry of this process. But you just sit as if nothing happening. I even said to myself, there are certain institutions that take an advantage. All this homoto is to you and you are DG. There's a reason why when people resign or leave an institution, there's a 1 month's notice. Some institutions take an advantage of that and say, your expertise was just too good. 3 days before you exit, we will have an interview. You're part of the panel so that you know this space that you're occupying much better than all of us. We are just part of the team that is going to interview, but your expertise will actually enrich us and you'll be able to advise us the best candidate on all the applicants. So why don't we ask people to leave? Because people exit institutions, but we just don't do anything about it. And by the time we appoint, it's 9 months after they are gone, we don't even know where they are. Some of them are well-retired grandmothers. They don't want to do anything about our institution. So those are things that we need to really be mindful of. Some government departments try, but the one that I'm associated with, Homoto, is not doing that. There are certain things that exit. These individuals exited our institution 9 months ago. We haven't had anybody championing the palliative care within our issues in departments. So we need to really up our game on that. Number two, all the other things I'm going to say would be related to why I had a passion for palliative care. Yes, when I was actually appointed to go and be in a program in the military that was actually looking after HIV positive soldiers and their families, and we started them. By the way, in that space, we started ARVs long before our government did. We were partnering with some institutions in the US, and then we started giving ARVs as early as the year 2000, 2001, 2, 3, 4. And you know, our government started kicking into the ARVs in 2009. So already as a decade, some of the people in our country, soldiers in particular and their families, were on ARVs through that program. Leave the battle, how we started that and whoever was fighting with us, but nevertheless we started. So I said to myself, okay, crudely so, these soldiers are now on ARVs. They've woken up from their deathbed. They're not dying. What are we going to do with them? Because they're not dying, but they are also not that well. So that is when this idea of saying, though someone has therefore got a life-threatening illness, they are not likely to be dying tomorrow, next month, next year, but there are certain challenges they have, which must give them some quality of life, even under those circumstances. Little did I know that I was going to be so well received in the UCT under Dr. Liz Gweth, and then I did palliative care. And therefore, that actually enriched me to say, you can then go out there and assist someone who has got a life-threatening illness, who's really not dying, but has got some challenges to deal with this pain. And people must be comforted to be able to, with the illness they have, on ARVs, be able to be having no pains and sleep well, and be able to wake up like all of us do, wake up and have a peaceful sleep. All of this, including other illnesses like cancers. So when I was doing the programs here, we were then taken to have a practical with one in one hospice, and here was this 10-year-old who had osteosarcoma, very aggressive tumor of the left knee. And this young person, we asked her, just go to us and tell us how you feel and everything else. He says, okay, no, I've had a discussion with my 8-year-old little sister and my 2-year-old brother. They came to visit me, and I told them that, look, I will not be with you on Christmas Day. I'll be in heaven. Look after mom very well. And therefore, someone had prepared that young one, that 10-year-old, to say, we have a very aggressive tumor. It's probably not going to really be, we are not going to be with us for until Christmas Day. So we'll be prepared. And how do you deal with that situation? And this young boy says, you know, I just want to go home and sit in my bedroom, which has got colorful pictures, and get mom bringing me custard on my bed. I want to die at peace at my house, at my home, in my bedroom. So those things are not easy, but then you are getting trained. So we now know that families who have been supported in that space are able to deal with grief much, much, much better than where we have not really had. Now, another thing, Motso, where you need to support me as a Department of Health, through my discussions with Ms. Tobegile, we now can say we had an ambition, and I'm now speaking on behalf of Michelle and all the people that we work so well with, because, by the way, this country went into the World Health Assembly meeting, and we accepted to be a sponsor of a World Health Assembly resolution that was actually wanting, saying we would, as a country, want to champion palliative care. And therefore, that having been said and done, we are not doing as fast as we are supposed to. There are two processes that must happen. The one is to say, therefore, we have a cohort of healthcare workers out there in clinics, in hospitals, that must get some introduction into palliative care for the reason that I've just given, because they look after patients. But number two, we need to say, for those who are entering training, largely nursing and medical, must be introduced into palliative care, so that you cannot therefore keep on going and do introductory courses of our healthcare workers, because from now onwards, all those who would be qualifying, whether nurses in 3 years' time, doctors in 5 years' time, would already have had that process. I am not aware, and we can only sit here as a deputy minister reporting if there's some progress that is going to be done. I hear that discussion in South African Nursing Council, we are not yet there. Now, is the Department of Health, where some of these entities are actually working with us, the SPCSA, to say, HPCSA, be closer to universities to make sure that these processes are happening. We are looked up by many African countries, and thanks very much to the support of the leadership that is here, as people who are really driving this program. But I think we can do much better and much more if we can do it better. So as we celebrate these 10 years, 20 years, I'm reminded of the 10 years that we then have had, because look, the 20 years of our theme today says 20 years of palliative and comprehensive chronic care for sustainable development in Africa. Now, as I was reflecting that in 2014, as a country, we were part of the World Health Assembly resolution. But again, continuously, our WHO DG, Dr. Tedros, in 2021 September, actually addressed a meeting of 194 heads of member states, calling them to develop such policies in their own countries to strengthen palliative care in response to the global challenge that we do have. Now, we are happy that by the time that meeting happened, we as South Africa were already rolling out the programs. But why he raised this, because he says it's actually very important, because the values of importance of strong palliative care in the health systems is actually imaginable in the whole world. I mean, palliative care, from what I've said, brings dignity. it reduces pain and suffering. Everybody will say, oh, I don't know I have cancer. I am on treatment, but I have a peaceful sleep. I mean, I get treatment I'm supposed. So that's what we need to hear from them. That is quality life, which we really are not giving to all our citizens. So we do need to create equitable access to palliative care for a range of both communicable and non-communicable diseases. And it's no longer an option that only certain communities should benefit. And we hope that among others that we are raising on this issue of NHI, universal health coverage, will also be inclusive of this. I like what Renee was saying in our discussions earlier, to say, maybe we should put it into ourselves in all discussions, in all policy formulation. We should be able to say, have you included palliative care there? And some of us who are advocates for such issues should always be doing that. It's a program that is not really well supported in many areas, in many countries. I'm delighted listening to Dr. Emmanuel just a few minutes ago to say programs that we are going to be looking into, especially next year, actually around the conference in Botswana, will, among other things, be wanting to improve, because if you don't get heads of states, ministers of health to really buy in very decisive on these processes, they're not going to move on very successfully. You need to actually find those leaders convinced that this is very, very important for all citizens in the world. Now, we do now know, and we're just sharing there to say, while we're having our success stories as a country, pockets of excellences here and there, we should take lessons of certain things that have happened, like the access to morphine or pain management should not be for those who can really go into the bigger centers, whether in Makerere or in Groote Schuur or in big centers, in big hospitals. It should be something that is going to be available to many people to access. The lessons we learned from the program called Nurse-Initiated Management of ARTs, where we would say nurses go out with pharmacists, with the doctor, and initiate treatment in various clinics. Empower nurses to be just as good as, in some communities they said, our nurse is just good as a doctor, we don't need any other person, this nurse. Because then nurses were able to initiate, they were able to look into the regimen and even change. We are therefore saying, let us empower, because in any country, in any community, there's always going to be more nurses than doctors. Now, if you want to accelerate access, you must rely on this pool of healthcare workers who are much more in abundance than any other. Because it's going to take long for every clinic to have a doctor, but you probably have all clinics, if you train them, if you train nurses to really have some knowledge on this, then you will not have patients who are wandering and not getting support. So I'm a strong advocate of this, and I always say to my friends, because as all of us are getting older, when I get real old, I would wish that I can only get osteoarthritis. Why? Because I won't know the pain of diabetes. I will also not know the pain in hypertension. But if I have osteoarthritis, I will always have pain, and someone is going to treat me for my pain. So I'm also like saying, I would love to be going that way, so that if you manage pain, you solve my problem. So if I have got osteoarthritis and that's the only condition I'm going to have, then I'm going to be fine, because I'm going to take medication for pain. Then I can go out there and walk with my dogs and do all sorts of things in my old age home, in my old age space. So I'm therefore wanting to strongly say, let us say citizens of the world will have life-threatening illnesses at any part of their lives. But we should always be there, that we walk the journey of this problem they would have in a way that is going to actually make them remain with dignity, supported. Now, I I really want to apologize to some of the colleagues that are here in the room that I've worked with so strongly, because your passion and focus is palliative care. As a deputy minister, I've been thrown to do all other things and have lost a bit of focus into palliative care. But please, you can still count on me. I'll still be part of you. I'll work with you in all these processes. I want to therefore say, all these organizations that are here today, and I'm delighted that I have the leadership of the African Palliative Care Association that is here, and all other leaders that are coming here to support and work. We joined this African Palliative Care Association in celebrating its 20 years of anniversary and look forward to making great impact and contributing to health components of our Millennium Development Goal for Africa's development. I also wanted to say, while we look into the 20 years, I was reminded of from 2014 to say the 2014 right to now is another celebration of this framework that we've developed as a country, and that comes from the World Health Assembly. So there's quite a lot to celebrate, but much more still needs to be done going forward. I wish, therefore, that you continue as you wrap up tomorrow to know that as few as we may be, some of us who are champions of palliative care, let us soldier on, because we really owe it to our patients. We owe it to those who really need such a service. You owe it to understanding. There was always what we taught, a block and then a line that is going this way to say, once you start diagnosis, at least palliative care kicks in there. It becomes bigger and bigger as you get towards the more advanced condition, but at least it kicks in there. So we want it to kick in as soon as a diagnosis of a life-threatening illness is made, because that is going to give comfort. And Michelle is agreeing with me. I still remember the notes that she gave me, and I still look back and learn. So, colleagues, I am so sorry I have to leave you, because I'm trying to get to KwaZulu-Natal as quickly as I can, because that is where I am supposed to be based right until elections. I stole the time allocated to me to be working there by coming to Western Cape, but I just thought I couldn't miss to meet with you and join you and wish you well and give you courage to say, soldier on. This is a very noble program we are part of, and wish that everything could really be wrapped up well nicely tomorrow as we then prepare for our next meeting again in Botswana next year. Thank you very much.
What else is there to say but just to say thank you so much, Honorable Minister. I was informed that there will be a picture taken with the minister and the entire group of people here present, and it will happen outside, just outside this room, or oh yeah, in front. Okay, so then we'll do that picture with the minister and everyone here in the front. I'll allow Wezerai to lead on that. Thank you.
And around the state. Should we move this next? I don't know if we will be able to. It can be moved behind. This thing. Huh? That's not really good. The rest of it, stand here. Let's come on the stage.
Let's do this. Just move it back a bit. Just move it back, yeah. Oops. Okay, let's all stand around. No, I think it's fine just there. That's fine. No, no, I think it's fine. People can be right a bit, yeah. Okay, just make sure your face is visible. Sorry.
But say no. Can we continue? Can we continue? Okay, so can I please ask everyone to take their seats? There's quite a lot that happened in 20 years, and we won't be able to revisit everything in one evening. So we really are making sure that we get all the highlights of the 20 years. So in 2004, there were a group of us who traveled to Arusha for the inaugural meeting of the African Palliative Care Association. But we all flew to Nairobi, and it took forever to get from Nairobi to Arusha. First, the buses took hours before they came, and then I can't remember how many border posts we went through. But at that particular meeting, Dr. Faith Mwangipal, who was the first executive director of the African Palliative Care Association, she was there, and that is where more discussions on forming the secretariat happened. And tonight, it gives me great pleasure to welcome Dr. Faith Mwangipal as the first executive director of the African Palliative Care Association to address us. Thank you.
Oh, wow, it's 20 years. I cannot believe this. It's been a long time. And hi, everyone. I'm so sorry I cannot be with you, but I'm so close to you. I'm actually in Mozambique. I'm in Maputo this week, and I was trying to see if I can get to you, but I can't because we've had some big events here in Mozambique. As you know, I work now to end child marriage. So I'm here with our members and our coalition in Mozambique, trying to see what we can do to accelerate change. So, but I'm delighted that I'm able to speak with you this afternoon. I remember the trip to Arusha, Tanzania. I was actually not meant to be there myself. I was supposed to be in Zambia with the Archbishop of Canterbury, but then that trip was canceled, and I ended up in Tanzania. And it was amazing to come late, because when I came late, I ended up sitting next to Dr. Joe O'Neill, and I started asking him who he was. And it's so great to see Joe here. And it was so funny because I've been writing something somebody is muting and unmute. It says the host has muted me. Can you hear me now? Great, yeah. So I won't take too long, so don't be impatient. So I met Joe and I asked Joe who he was, and he said he's the advisor to President Bush, and I thought, you must be lying. And it was interesting because I wasn't expecting Joe there. And we talked a little bit about what are some of the things we can do. And Joe, you had come to Arusha, Tanzania to find out what we are doing to end palliative, now child marriage is in my head, to start palliative care in Africa. And it was amazing to be there. But a year before, or about 2 years before, I had met Dr. Anne Merriman at The Hague. We were there for a meeting on spirituality and palliative care. And Dr. Anne Merriman said to me, you have fire in the belly, we need you to be in Africa. And indeed, 2 years later, I was in Africa working for the African Palliative Care Association. The things I remember are many, from starting our small strategy with John Palin in Botswana, in Zimbabwe with people from USA, Tanzania, South Africa, having our first office at Machindi, Uganda, and even being chased out of Swaziland because we had not really met a few important people when we went to Swaziland. But I think what is exciting is to see where we've come from, where we've come. We've come from very small beginnings. And it's amazing that whenever I reflect on my own leadership, I think about the African palliative care as the place where my leadership was born. And I'm always so grateful to the many giants upon whose shoulders I stood, many of them who are not here with us. the late Dr. Kath DeFilippi. We miss her dearly, but she was such a champion and really a great ally for palliative care. Dr. Mark Jacobson, who was my chair of the board, who we miss. Sam Kwanazi from Zimbabwe, who was part of the first steering committee. Julie Chitty, who was the ally for Joe, and they worked very closely with Joe and really helped us with our first strategy. We had many people when we started, and all of you in this room. Julia Downey, I can see you are there. I looked at the list. You are part of my ally and my right-hand person. And we did our strategy together when you joined us as our Deputy Executive Director. And there are so many people I can be thankful for. I remember Andre Wagner coming to Uganda to teach us to do organizational development. Andre talking about self-care and how we can be better in looking after ourselves. I do remember Emmanuel on my board as well later in the years. And I remember many people, and I'm sure I will forget some really key people. And today, as I was sitting here in Mozambique, I remember Lydia Mondane, who is on here. And I remember starting this association of working with the Nurses Association in Maputo to make sure that we start palliative care. And one of the things I'm so proud of until today is that we were able to introduce palliative care in over 20 African countries with a modest budget, with a small team, starting with Dennis, who I've kept in touch with out in Indiana. Others like Fatia, who are really our staff who really worked closely with us in terms of learning and development. Josephine, our director of finance. There were great people we worked with. Patricia, who started with us and she's still there with APCA until this day. And I'm so thankful for people like that, because it's people like that sometimes who are the unsung heroes for what we have achieved today. 20 years is indeed a long time. And Andre, you're right, that we cannot be able to remember all the things that happened in 20 years. But I was so delighted recently when I was approached by the True Colors and they asked me to join them in their advisory committee for palliative care in Africa. And I thought, you can never take palliative care out of my heart. Even if I'm no longer working in palliative care, I still talk about it. And it's a great opportunity to be talking about palliative care with True Colors Trust. And I'm excited to be meeting them next week at their board meeting. And those are some of the things which really gives me joy when I see even what the deputy minister said, when we see that work continues, despite the challenges we are facing as a planet, because we are facing many challenges, may it be conflict, may it be climate change, may it be crisis and cost of living. We are facing many challenges which are making it difficult, that much difficult for us to provide the services we need to the people who need them most, especially the most vulnerable. But I'm delighted that APCA, you've kept going with strong leadership from Emmanuel. And I just want to congratulate you for 20 years. And I know there is going to be even another 20. And my call on you is to keep going. Keep going. If there are places we can help, if there are places we can champion, please let us know. Because while we are not close with you, we remain strong champions for the work we do. I'm here in Mozambique, and whenever I come to Africa, I live in London these days, but whenever I come from Africa, I'm always reminded of the great times we had, moving around from one post to the other, moving to 10 countries to do policy review with Mary Calloway, the Open Society Foundation, and many, many colleagues and allies trying to bring to bear the things we need. And I feel that those are the great foundations which have made you where you are today. And as we walk and as we look back in the many giants, let us make new friends, let us create new opportunities, let us chart a new course, because the world needs really real champions, because the world we live in today is very different from the world we were living in before 2019 or before 2020 for that matter. So it's requiring new leadership, it's requiring new allies, it's requiring new conversations. And I'm so delighted that we are having this conversation. But for this evening, there's so much I can tell you. I was even writing here thinking, what is the most important thing to say today? I think the most important to say things today is that I am so proud of where we are. I want to congratulate everybody for what has been achieved, for what is yet to be achieved, because there's so much more ahead. and for the more memories we have created together. I'm better today because I was part of you, and I continue to be part of you even if I'm not there with you. I would have loved to be there. I've heard there's a conference in Botswana. Please let me know in good time. I will plan to be there because it's amazing. And to see Malik, who was amazing, who introduced us to the Southern Africa office in Pretoria, and we got our first big PEPFAR grant from the region. It's amazing. And Joe, you paid my first salary when I was the director of APCA. I'm ever so grateful for that, because it's people like you who believed in us when no one else did, that we were able to start. And I'm so proud of what we have achieved. There are so many I would have liked to mention. I have so many memories. And I know I'll sleep at night and I'll be thinking, I should have said this. So I'll write for you a little write-up for the things I remember, and I'll share with you so that we really capture those memories, because indeed 20 years is a long time. I came to Uganda with my 4-year-old son. He's a strapping 24-year-old now who has finished university and looking for a job. So it just shows you how time flies, because just seems like yesterday as I reconnect with you. I'm being told my internet is unstable, so that's a signal for me to stop. But I want to stop by saying, congratulations. Whatever else you do, please count me in. And next time I'll come face to face. Thank you, and I love you all. Thank you. Andre, you're muted.
Faith, thank you so much. And thank you for being a lifelong giant and fighter and advocate for palliative care. At the time when Faith was the executive director, and the first board of the African Palliative Care Association was established, Kath de Philippi was the chairperson of the board. Kath is the person who is responsible for me being in palliative care. And I can imagine that there are many people, not only in this room, but across the world, who can say exactly the same, that Kath de Philippi was one of the people who got them into palliative care. So Kath has sadly passed away last year, and we have a very short clip just to remember Kath by.
From where we began. Oh, I'll tell you all about it when I see you again. When I see you again. Damn, no, all the planes we flew, the things we've been through, that I'll be standing right here talking to you about another path. I know we love to hit the road and laugh, but something told me that it wouldn't last. Had to switch up, look at things different, see the bigger picture. Those were the days, hard work forever pays. Now I see you in a better place, see you in a better place. How can we not talk about family? Family's all that we got. Everything I would do, you were standing there by my side. And now you're gonna be with me for the last ride. It's been a long day without you, my friend. And I'll tell you all about it when I see you again.
See you again.
We've come a long way.
Yeah, we came a long way.
From where we began.
You know, we started.
Oh, I'll tell you all about it when I see you again.
Tell you.
When I see you again.
Thank you very much. All I can say is that we are because she was. So we've heard from the first executive director of the African Palliative Care Association, and now we have an opportunity to listen to the current executive director of the African Palliative Care Association, Dr. Emmanuel. Thank you.
Thank you very much, Andre, and thank you very much, everybody, for joining us here and for our colleagues who are joining us online. 20 years is not a short time, but it's an achievement that we celebrate together. And as we celebrate the 20 years, I want to highlight a few things and a few people that have made this happen. The founding committee that met to discuss the initial strategy towards setting up APCA, you are all thanked and acknowledged for putting in place the frameworks and contacting the key stakeholders that eventually resulted into the African Palliative Care Association. The founding board that was chaired by Kath, and as you've seen, we all miss Kath, but we are celebrating her because she left something behind that is creating ripples on the continent and beyond, together with her other board members. We want to remember Professor Mark Jacobson, who took up the mantle from her, and he has also since passed on. We want to thank Professor Anne Merriman and the team at Hospice for hosting the organization when it started off. We want to thank the board, the founding board, for finding the appropriate executive director in the name of Dr. Faith, who then put in place policies, guidelines, processes, networks, collaborations that are sustaining the organization up to this day. We want to thank you very much, Dr. Faith, for that. We thank the key people that linked us to the resources, and Dr. Faith has already acknowledged some, including Joe and many others. We thank the successive cohorts of APCA staff who worked professionally, and some are still working with us to ensure that the organization met its goals. One of the key things about APCA is financial accountability. Since APCA was started, the organization has been having unqualified audits, and we give credit to the staff, especially people within the finance department, those who have left and those who are there now. It's one area where you never worry as the executive director. And we thank you, Faith, and the initial team that put the systems in place for that. We acknowledge our donors from different backgrounds, the trusts and foundations, academic entities, government developmental departments, especially in the USA and UK, and the rest of Europe. You heard about USAID and the work that was funded to happen within Southern Africa. And I think that was the biggest grant ever that APCA got, in addition to the one by the Diana Fund. And we thank all those donors, True Colors Trust, OSF, OSIA, OSISA, FASHA, GPIC, and most recently the Irish Hospice Foundation, American Cancer Society, Elton John Foundation, King's College London, University of Leeds, WHO, UNODC, Government of the Kingdom of Belgium, Rand Corporation, Makerere University School of Public Health, and many others. We also thank the government of Uganda for hosting our secretariat, and for especially the current crop of our staff who are doing more with less in a very changed environment after the COVID pandemic. Every member who has served on the APCA board as a member or as an advisor, we value the input that you've made in the organization. That has meant that there's no one time when the APCA board never met. There is no one time when we had a gap on that board. It's not many organizations where you go and you've had successive boards coming in place. And we thank you very much for that, and Andre for teaching APCA from its founding about organizational development. We also want to thank the patients who have contributed to the added voices for us. They speak from experience. They speak from something they have lived. And that has enriched our advocacy efforts. We thank all of you who are from hospices, from ministries of health, from other non-government organizations, but also all those entities that have received and partnered with us, received funding from us and partnered with us and not let us down, but have enabled us to keep the name and the reputation that the founders so much loved. I thank you, all of you, for coming to celebrate, to launch the celebrations for the 20 years. And I hope that we'll all be able to meet physically in Botswana in September next year, when we'll crown the celebration of the 20 years by having ministers of health, government departments from all over Africa with us at that conference. In a special way, I want to thank Patricia, who is seated at the back there, who has been the power behind organizing this event, together with Wezrai and the other APCA staff. If I've forgotten anybody, it's not because you've not done it, but it's because I'm overcome with excitement about this event. Thank you very much, everybody, and may God bless you.
Thank you so much, Emmanuel. I believe that every person just needs one person to believe in him or her. And our next speaker really believed in that in a few months after we had our initial discussions in Arusha, that an organization will be registered, that the organizational capacity will be in place, and the organization will be ready to have its pre-award assessment in January of the next year. And when they called me from breakfast that morning, and Faith said, there are no policies, we need to develop all of these. That was the first Christmas that I spent writing policies and procedures. So it gives me really great pleasure to introduce Professor Joe O'Neill, who was that person who believed that palliative care in South Africa, on the continent of Africa, can go places. Thank you very much. Welcome, Joe.
Joe, you're on mute.
I'll try it again. Thank you, Faith. Once again, you saved me. I find this a very emotional meeting, seeing so many people and remembering so many people and so many good things in the world. And Faith, you did a lovely job in your speech, and I echo everything that you said about the courage and the vision and the love. I feel it all as well, and what an honor to be here with you all. But I thought I would, Andre, I have to say, once again, you put me to shame with your clothes. I don't think there's been one moment in my career in South Africa that I haven't been poorly dressed when Andre walks in the room. So once again, some things never change. So my journey with palliative care began years ago as I was an AIDS doctor in a poor clinic in Baltimore, working with an amazing physician who was teaching me a lot of things. And one day she watched me with a patient, and after I was done, she said, you're a very good palliative care physician. And this was Carla Alexander, who some of you know. And I said, what's that? What's palliative care? And she explained it to me. And I thought, boy, I didn't even know that existed in the field of medicine. And so, became interested then. Fast forward a number of years and a number of experiences, I found myself in the Oval Office with the President of the United States, who said to me, I'll get you however much money you need to turn the epidemic around in Africa, but don't come back and tell me just to write a bigger check. What he meant by that was, I want to see I don't want to just write a bigger check to CDC and USAID and let the bureaucracy continue with though, and I really want to do something different. And I think all of us understood that to tackle HIV, we needed to do something different. It wasn't a development problem, although there were development aspects to it. It wasn't a prevention problem. It wasn't an epidemiological problem, although those are important tools in it. But it was really a delivery of care, doctors, nurses, drugs, hands-on care. So in the discussions, so he said that to me, and no one knew that we were working on this. It was kept under wraps for an entire year until it was announced in the State of the Union address. But I spent that year spending a lot of time in Africa with many of you people, learning what was going on, seeing what Ann Merriman was doing in Uganda, and seeing how the epidemic was impacting and what needed to be done. And I became aware of the importance of palliative care in the field. So when I came back and we were sort of talking, particularly within ourselves on the Policy Council in the White House, I started talking about palliative care. Well, what was really cool is very few people actually knew what it was, but everybody liked the term. So I started throwing it around and attaching any meaning to it they could come up with. But I was happy because people were talking about palliative care and the words were being passed around. And that's how we got it into the legislation. And then we were able to steer the money in the directions that you're talking about. And I guess I mention this because I want to remind us all that all of this began with Carla, for me, from my perspective, in a little storefront clinic in Baltimore 30 years ago with somebody saying something about palliative care. And it grew, it magnified, we met each other, we worked together, APCA was formed. And yeah, the road ahead is long, as Andre said, but the road behind us is pretty long too. And we've had each other, we've had the grace of God, we've had the love and support of our patients. And I just want to recognize that any of us, whether we're in powerful places or or a patient ourselves, I spent the last period of my career before I retired working as a palliative care physician at the NIH, taking care of many, many people who are anonymous and not well-known, not famous people who touched me deeply. And all of us go through life with that ability to bring vision and care and love to other people, even if we're unaware of it. So I want to congratulate us all on what we've done. I'm not mentioning any individuals because I know if I start, I won't stop and I'll still forget somebody. But just wishing everyone courage, love, and congratulations on everything that we've done to get us to this point. And thank you so much for letting me be here. And it's wonderful to hear these names and voices from so many years ago. Thank you.
Thank you so much, Joe. It's actually really amazing to sit and look back over these 20 years. I think when I was preparing for this event, I didn't imagine that it was going to be such an amazing evening. I would, for the first time, when I heard the words fire in the belly, was probably at a time when I was a little boy and I ate spicy food. And I told my mother that I don't know what's going wrong. And she said, there must be a fire in your tummy. Then many years later, a phenomenal palliative care advocate, someone who has been responsible for the development of palliative care in so many countries, used the same words when she spoke about being passionate about palliative care. Professor Anne Merriman said, when we talk about palliative care, we must have fire in the belly. Welcome, Dr. Professor Anne Merriman. Thank you.
Thank you. Thank you so much for that introduction. Excuse me. I've got a frog in my throat as well as fire in the belly today. I was calling my hopefully short talk today, the hidden history of APCA in the very early years. This all started in Gaborone, as you have heard already, and in Botswana. And I was sitting next at that conference to Anne Lloyd Williams from the from the Diana Fund. And as we were talking, Anne said to me, we ought to have an organization like the European Association for Africa. And it struck me that was something we hadn't thought about. And she said, but it has to come from the Africans themselves. And so we were trying to hide where we had come from. And that when we went to the next meeting, which was in Cape Town, and it was brought forward by the Africans themselves, and they formed a steering committee. And this is where I came in for the first time, because I was asked to be the chair of that steering committee. And that was 2 years before APCA had commenced. We had been in the country since 1993 with a vision of palliative care for all in need in Africa. And now, although at that time there was only 3 countries that had palliative care in Africa when we started, and that was 1979 Zimbabwe, 1980 South Africa, and the last one was Nairobi, where I was the first, their first medical director of the Nairobi hospice. And I had come to them from Singapore, where I had been for 7 years, 6 of them teaching in the university, but also at the same time doing home care in my spare time. And, you know, now that I'm the only one left alive of that group, and, you know, of founding their palliative care, particularly in the home, which was so important. But then we had to have meetings regularly with the steering committee, and they would come to Uganda. And at the same time, we had started an office in our own hospice in Fazal House. Fazal was the beautiful lady who started Hospice Africa with me. But because her father was murdered after the first few months, she had to leave us to go back to her family. But so many problems have come over the years since we started. Last year, we actually celebrated 30 years. And when we came, sorry for my hesitations, when the steering committee was working, I can't remember everybody who was in it, but I do remember Catherine Philippi, and I also remember my friend from Zimbabwe. But we met regularly, and we made different plans for APCA. And one of the things was it was going to be called the African Hospice and Palliative Care Association. Now, as I was the chair of the steering committee, I gather it was that reason that Faith, who I knew very well, because the Diana Fund was the first to ever give us money to go into further on into Africa. And they gave us it in the year 2000. And I got to know the people in the Diana Fund very well. I got to know each of them, and I knew Faith very well. But Faith came to me and she said, Anne, I know that I could help APCA. I know that I could do the job that you're looking for. At the time, you will all remember we were very worried that we hadn't got a suitable person as the chief executive of the new organization. And I knew Faith, and I believed her when she said, I can raise money. And I knew, because she was a beautiful speaker. As you all know, who have heard her at conferences, she's a wonderful speaker. So she said to me, but there's one problem. I'm afraid to speak to my boss in the Diana Fund. And I said to her, oh, it's okay. I know her well because she was one of the people that got us the money a few years earlier. And I said, I'll ask on your behalf. So I rang her, but I was nearly blown off the planet. She was very angry with me for suggesting that their wonderful Faith might leave them to come to Africa. And, you know, it was a very, very sad time that she talked like that. But after that, she actually tried to write us out of the palliative care equation completely, not just here in Uganda, but throughout Africa. And it was a very sad time for the few years after that. But one of the saddest things for me was that she took the word hospice out of African Hospice and Palliative Care Association. Now, the word hospice comes from the Latin hospitium and from the Greek hospes, and it means hospitality. And that's what we're all about, hospitality. And that was taken out of your name, APCA, and I was really so sorry for that. Because to me, it was essential. The word hospitality and the other word compassion are a part of us, a part of everything we do. And things continued, but what happened was that Mark was close to us. He was part of the steering committee, and that's Professor Mark, who has passed. I only heard that today, actually, that he had died. I didn't know. He was a great man. And he came to me and he said, I will book a hotel in Russia for the very first conference at which we can launch APCA. So I said, great, let you. Now at that time, we were very much dependent on America. And my friend here today, you know, I'm getting old and I've forgotten your name already. Tell me your name already. My American friend. Maybe he can't hear me. Somebody else.
It's
tell me.
Joe. It's Joe, Anne. It's Joe O'Neill. Mm.
Yeah, Joe O'Neill. Joe O'Neill came frequently to us, and he came to hear what we'd done and what we were planning with the steering committee. And he said he would try and get the money. And then they had a conference in the White House Conference Center in America, and he asked me to come and talk at that. I think I was the only one that was representing Africa at that meeting. And the other people were big people in palliative care, but they were in the developed world. And, you know, I met a lot of people there in those days who have grown much higher now since those days. But it was after that they were starting this special fund for HIV. And it was promised that, I think it was something like $15,000 were going to go towards palliative care. And this was wonderful. And so that we were depending very much on money that was coming from America to help us set up APCA. And one of the things that they were going to pay for was that hotel. Now the hotel wanted the money 2 weeks before the conference, and it came to 2 weeks before the conference, but the money hadn't arrived. So it was a big problem. But I got in touch with Hospice Africa UK, which is where we started Hospice Africa. And they immediately sent £20,000 to pay for that hotel. And we saved the day that day. But when the money did come from America, it was actually put into their accounts as money to support the new organization, but it was really to save that day. And actually, Hospice Africa UK were a bit upset because we weren't acknowledged for saving something that was so important at that time. But anyway, as I go on, when we started, as I said, there was only 3 countries had palliative care, and now, because through our teaching, there are 37 countries. Now, what's the difference between us and APCA? Because there was a lot of problems with some of the early staff, including the chair of the board, that we might be overcoming what was trying to be happened by APCA. But we weren't, because for us, it was so important that in order to spread palliative care, that education and training was a big part of our work. And it has been, we still continue that education and training, and we have a huge alumni now in these 37 countries. And twice a year we have training online for 3 months, and one is for the Anglophone countries and one is for the Francophone countries. And I understand that we've been trying to get our things translated into Portuguese, but meanwhile, APCA have been doing a great lot of work with the Portuguese countries, and that is wonderful. Now, let's see. I'm sorry, I had got this all typed out today, and just before this meeting, it got wiped out. So I'm really going back to my notes. Yeah. So Faith joined, and she was a wonderful person. She really did great work with APCA, and she set up things that we had never even thought of in hospice, of structures that would maintain the employees. Now during those 2 years that we were doing there, I was looking for homes, both for Faith and her family, but also for the new APCA. And we got a house just up the road that could be rented. And that house was rented for many years, and now they've bought it. And it has worked as a very good place for APCA, and it's so close to us. And the Palliative Care Association, which was also started in hospice and is working so well throughout the country, they also were still quite near to us. So people who visit, one of the three of us can visit the others and see how we're doing in this country. So here we are now, and I'm very grateful to Emmanuel for inviting me to talk today, because I felt this was a bit of the hidden history that went on. I have suffered a long time from the Diana Fund lady that was so upset at us taking Faith, but I'm glad that we did it in spite of all that, because Faith did a wonderful job, and Emmanuel's done a wonderful job. And I can't believe that when we started that steering committee, we couldn't see what was coming. We didn't know where we were going. And now when I see how far they have gone, I just have to thank God that you've done so well, and to thank each of you that contributed to those early days when we struggled. We really struggled, and we suffered pain. So did the steering committee suffer pain when what we had planned was almost taken away. But anyway, it's continued, it's done very well, and I just want to say God bless all of you who took part in that, and particularly God bless the present team and particularly Emmanuel and Patricia, who sorted this out, and Eve, who is a great help not only to APCA but also to us, particularly when we are writing research documents or documents about things. And you are our friends. I don't see you very often, Emmanuel, but I don't see many people these days because I'm getting very old. But in fact, I'll be 90 next year, guys. Maybe the first one to reach 90 of the beginners. Yeah. But we recently celebrated my birthday at hospice with a mass, and with we brought in many people, and it was wonderful to see how much our patients, even poor patients, came forward and gave me money, and we do deal with an awful lot of poor patients, and it was really heart-rending to see them. And they were smiling and they were dancing, and it was a great day altogether. So everybody thinks I should have popped my clogs a little while ago. I've had so many illnesses in the last 5 years, but I'm still here. And if God spares me, I'll reach the 90th too. So God bless, and thank you for allowing me to speak at this very special meeting and the launch of the 20 years of African Palliative Care Association.
Thank you so much, Anne. I mean, just such a wealth of history and experience. In South Africa, palliative care was really the biggest, I think, our growth in delivering palliative care started with PEPFAR in South Africa, when the Hospice Palliative Care Association got their first grant from USAID. And that very first grant was to provide palliative care in all 9 provinces. And the first grant was $2 million. The organization grew, and our relationship with USAID as a funder also just became stronger and stronger. And the very last grant that the Hospice Palliative Care Association got was for $50 million. And none of that would have been possible if we didn't have an activity manager for palliative care who was passionate about palliative care. It was usually those of you who get USAID funding, when you have your meetings with the funder, that's usually when you get very anxious and very worried. We looked forward to our meetings with the activity manager, and it really gives me great pleasure to introduce Malik Jaffer to you, who was the first activity manager for a palliative care award in South Africa.
Thank you, my brother Andre. Thanks to my sister Toby, to all the colleagues and dignitaries in the room, all friends, peers, family members, all protocols observed. It's such a great opportunity to be here, to see everybody today that I haven't seen in a long time, and to hear voices we haven't heard for a long time. And when I was thinking about my remarks today, I was reflecting, and I had this idea in my mind, and I'll expand on this idea in just a minute. But I had this idea, and so just to take a step back, in 2004, I started with USAID funding in Nigeria, working with a team there to start palliative care and community care. 2006, I moved to South Africa, working on the HIV care program, palliative care, and then later on, health system and community health systems and human resources for health. Julie Chitty connected me with Dr. Faith and APCA's work, and then starting out initially as an advisor to the board and later on a board member. It was really a life-changing opportunity for me to be able to contribute to APCA's work on the continent, and however small, I hope I've been able to be an advocate for that. USAID's funding there, I think, through to APCA and through the Hospice Palliative Care Association in South Africa, I think we're hopefully contributing to that element. Just to go back, in 2006, when I moved to South Africa, 1,000 people were dying every day just from HIV, not counting cancer, not counting other diseases. 1,000 people a day in South Africa alone, not to mention the rest of the continent, were dying from HIV. Over the last 20 years, we saw huge changes: government commitment, policies, advances in procurement strategies, changes in the healthcare workforce, expansion of services, government leadership. We've seen in South Africa increased life expectancy now. Over the 20 years, or over the time between 2006 and when I left South Africa in 2020, work that the Hospice Palliative Care Association was doing, 98% of the patients that were being seen by HPCA were seen in the community. They weren't being seen in large facilities. They were being seen community or community hospices. Of the people that are being seen, 98% were being discharged from service. It means that the care that they were receiving was integrated and holistic in a way that meant they had an opportunity for quality of life and had an opportunity for hope, not just of death and dying. And even if there was to be death and dying, you could be assured it was going to be with dignity and respect. As part of my role at USAID, I had the opportunity to travel across the beautiful country of South Africa. And just to give you, I just want to tell one story. I mean, everybody's got a story. Everybody's got hundreds of stories. But I remember being at Soweto Hospice and seeing this young girl who probably looked like she was 6 months. I think she was about a year old, but she was tiny. She was so tiny. And I held her in my arms, and I knew that any moment now, this was her last moments on earth. I mean, I knew it. She was at the end. And about 6 months later, I was back at the hospice. And this girl was there. She was alive. She was thriving. She was smiling. She had put on weight. She was growing. She was going to have an opportunity to go home, to lead a life that she wouldn't have had if it wasn't for visionaries like Dr. Ann, for Joe, for the work of Dr. Faith, Emmanuel, and so many hundreds of others across the continent that gave people like her a hope and an opportunity we wouldn't have had otherwise. It's the commitment of country governments, of dedicated staff across the entire continent, the generosity of the American people to have through their tax dollars to fund USAID and the PEPFAR program. So in this idea about my talk, I was thinking about APCA and I was thinking about integration and integration of palliative care into the health system, into the broader health system. We know that palliative care, it's not a separate activity. It's not a simple thing that you do. There's so many key elements to a well-functioning health system that without having palliative care as part of that, without having adequate pain management as part of that, one cannot truly say we have a functioning health system. And so that was something that APCA really embraced and took on, and it was a key element of what USAID wanted to accomplish. It was a key strategy, integrated services as design, not as an afterthought. Integration of physical health, mental health, social health, spiritual health. Father Rick would kill us all if none of us said spiritual health or spiritual well-being in this discussion. So I want to bring that out. But all aspects of the individual to heal and treat and work with them with dignity holistically. Elements of integration, the use of multidisciplinary teams, everything from family members to doctors and so many cadres in between. And the integration of policies into African governments as part of their healthcare frameworks. And I was thinking about this idea of documentation and research and the amount of work that's been done into documenting, researching, testing, and looking at findings, over 170 peer-reviewed publications from APCA over the last 20 years, not to mention, hundreds of conference presentation, abstracts, articles, contributions in book chapters, not to mention all the things that happened at individual national associations across the continent. So a tremendous amount of documentation and research that's happened. The amount of data and data utilization, data collection that's so important to donors to document that the work and the excellence and the impact that's been done. So I had this idea as I was reflecting about excellence and the excellence and quality that goes into palliative care, striving to meet the needs of those needs, looking at elements of equity and principles of social justice that are really underpinning what does it mean to have dignity for every human being that we work with. And I had this idea of, advocacy and advancing palliative care on the continent. This is really APCA's reason, right? It's to promote access to palliative care for all in Africa, is really what it's about. And so this idea that I was thinking about was really just that, IDEA, integration and integrity, documentation, diversity and research, E for excellence in service, equity and social justice, and underlying that dignity of every human being, and A, of course, for advancing and advocating for palliative care in Africa through APCA. So as I wanted to I'll end my remarks there, but I had this idea, and really this idea is what APCA is all about. And so congratulations to everybody involved. It's everybody from the person making tea to holding somebody's hand as they pass away, that it really does take a village, and the role and the contribution of everyone involved. Without it, we wouldn't be where we are. So congratulations to everybody. Wonderful, wonderful 2 decades, and one hopes for and prays for many, 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 many more years to come.
Thank you very much, Malik. I just think that, we have 3/4 of the picture now. So there's one more quarter left, but before we get to that, we will have a break because dinner is served. And during the break, we will have 2 videos playing, one by Julia Downing and another one by Catherine Peters, to look at during the break. And then we have 1 or 2 more items after dinner, and that will be for the rest of the evening. Thank you very much. Enjoy your dinner.
And I'm delighted to be able to join you virtually as we begin the celebrations for the 20th anniversary of the African Palliative Care Association. Greetings, and I'm delighted to be able to join you virtually as we begin the celebrations for the 20th anniversary of the African Palliative Care Association. It's hard to believe that it's 20 years since we were at the Lord Charles Hotel in Somerset West, when we were meeting together, when we were thinking about the development of palliative care in Africa and a possible development of an African Palliative Care Association. And then as I was part of that initial steering group and the initial board of the African Palliative Care Association, it was exciting to think about what we could do as APCA, how we could increase access to palliative care across the region. And then, of course, as I joined as the Deputy Executive Director for many years, and since then, as I've continued to work with APCA in different ways, and particularly collaborating through my role as the International Children's Palliative Care Network and my ongoing role in the development of palliative care in Uganda. And also, importantly as well, as part of APCA UK. So I'm delighted that these celebrations have begun. I'm sorry that I am unable to be with you as I am at the EAPC conference in Barcelona, but I hope to join with you virtually, and just to say congratulations on the start of the 20th anniversary celebrations of APCA, and I look forward to celebrating with colleagues over the coming year and for the conference in Botswana. So congratulations and see you all soon. Thank you. Greetings, and I'm delighted to be able to join you virtually as we begin the celebrations for the 20th anniversary of the African Palliative Care Association.
First of all, congratulations to APCA on your 20-year anniversary. You've come so far and accomplished so much. And thank you to the organizers for inviting me to give this brief presentation on improving availability of internationally controlled essential medicines. I'll speak about the crucial role of civil society in my capacity as Senior Advocacy and Partnerships Director for the International Association for Hospice and Palliative Care. So this is the map of global injustice and inequity. You could also call it the map of shame in the consumption of controlled medicines from the International Narcotics Control Board, which shows the enormous disparities between the dark red, bright red, and pink countries at 20,000 standard daily doses per million inhabitants per day. The high end, as you can see, is in North America and Western Europe. And the Western Europe is pink, which is the benchmark, actually. And the African continent colors of light purple or gray from 1 to 100 standard daily doses per million per day. And I know that's complicated and I don't have time to go into it. Some of you already understand this, but those daily doses per day is a proxy for the different levels of health-related suffering due to lack of availability of controlled medicines and overconsumption, which causes public health problems such as the overdose epidemic in North America. So this map is a bit dated, but the situation hasn't changed very much, unfortunately. The advocacy and global situation of the normative framework, which we call it, which is the legal and the framework created by laws and resolutions and declarations about controlled medicines, has changed, though. And it supports improving availability through national and regional legal frameworks, through changing those, and training of health workforces. In other words, what the new global normative framework is asking us as civil society, member states, academia, all the partnerships, is to turn this whole world pink, rather than all these different colors which show overconsumption or
Palliative care, and that has 4 components, which include access to controlled medicines, development of national policies, service delivery through various projects and grants, as well as through education. And on this, we focus on providing scholarship opportunities to health workers to become palliative care experts. The third objective is research, through which we generate evidence, models, and best practices, which can then be implemented in the various African countries. The fourth objective is sustainability, where we look at sustaining the organization, sustaining our membership, but also sustaining palliative care as a discipline within the continent. The African Palliative Care Association is marking 20 years since its founding. This comes at a time when we are looking back and being thankful for the founding fathers of this organization who met in Cape Town 20 years ago and conceived the idea of meeting the gap of access to palliative care on the continent by founding this organization. We give special thanks to the founding board that was headed by Kath De Filippi, may his soul rest in peace, and the other founding members, including Professor Anne Merriman, Dr. Mark Jacobson, Dr. Z.P. Ali, and many others. These were key persons, among others, who worked tirelessly to see this organization formed. But also in a special way, we thank the donors who picked up from the idea to make it a reality, especially the Diana Princess of Wales Memorial Fund, True Colors Trust, the US and UK governments through their agencies such as PEPFAR and DFID then, and many other funders, including the Open Society Foundations and its initiatives in Eastern Southern Africa. One of the key achievements has been the Small Grants Program, which is funded by the True Colors Trust, where every year about 20 organizations receive grants which they use to implement palliative care work throughout the continent. And we thank our board and staff that have made sure that all the funds that we get are used for the sole purpose for which they are given. We've never had audits that are out of what is expected of a well-performing organization. Among the achievements that have been recorded, the African Palliative Care Association has supported several countries to develop their national palliative care policies, and Rwanda was the first, Eswatini was second, and then others followed, including Tanzania, Mozambique, Malawi, Zimbabwe, Zambia, and many others. In addition, the African Palliative Care Association has worked towards strengthening health systems by integration of palliative care through improving access to essential palliative care medicines, especially morphine, strengthening education by offering palliative care scholarships, as well as providing small grants for hospices and community-based organizations with the support of True Colors Trust to ensure that palliative care reaches those who are in most need. We are also glad that we have research projects that are ongoing in partnership with universities in different countries, in Uganda, in the rest of Africa, and in Europe and North America. Those are still ongoing partnerships, and they are very valuable, and they have made it very easy for the African Palliative Care Association to meet one of its key objectives, which is producing palliative care evidence through research. In a special way, we thank all the teams that have worked at APCA, starting with the founding executive director, Dr. Faith Mwangi-Powell, and her team that set up a robust system at the organization that has seen succession of teams at the organization and creating a very sustainable organization over the years. We offer technical support to countries to build their capacity to reconstitute oral liquid morphine for use for pain and symptom control in their countries. We were also part of the PEPFAR program through the regional HIV/AIDS program in Southern Africa, where the African Palliative Care Association worked with various stakeholders in countries in Southern Africa to ensure that palliative care was integrated in HIV care in those countries. Since its founding, the African Palliative Care Association has hosted triennial international palliative care conferences in different African cities, bringing together health workers, beneficiaries of palliative care, policymakers, educators, and other partners to share best practices and progress made. We value the partnerships that we hold with other agencies, as well as working in partnership with UN agencies such as WHO and the United Nations Office on Drug and Crime, where we've implemented a project on access to controlled medicines in the Democratic Republic of Congo. Since 2013, we've also been hosting the African Ministers Palliative Care Session. The first one was hosted in Johannesburg, South Africa, and since then we've had one in Kampala in 2016, another in Kigali 2019, and then back to Kampala in 2022. These are achievements that we do not take for granted. But above all, we thank everybody that has been part of this journey, and we now look forward to the next 20 years as we celebrate, and we'll have a climax of these celebrations 25 September as we hold our international conference. It's nice for us to be launching these celebrations in Cape Town, where the idea of the African Palliative Care Association was conceived.
Hi, while we are just eating our dinner. So this video is a work in progress, and we would like to compile as much of the history of APCA as we can. So please, if you have favorite photos and memories that you can share with us, that we can add to this until we get to the conference. We want to make it as representative as possible of all the different parts of the journey that APCA has gone through. So please do send your contributions to me. We can use info@Africa, or you can send direct to me. You're most welcome. Thank you.
So we want to make sure that we finish the program before people start leaving. So there are just about 3 more items on the program. And there's a lot of work that different people across the world have done, and the Pain Policy Group has done a lot of work with Jim Cleary. And I mean, at conferences, you've heard him speak, and I always love his presentations because there's always just a picture with no words or a picture with 1 or 2 words. And I am going to ask Dr. Barbara Hasty to come and do a short talk just around the work that that group has done, and then also introduce His Excellency, the Ambassador Ghislaine de Hoop from the Belgian Director General of Foreign Ministry and the current EU President. She will also introduce a video by His Excellency. Thank you.
Thank you for this incredible opportunity, and greetings from my colleagues from the former Pain and Policy Studies Group and at University of Wisconsin and the Walther Global Palliative Care and Supportive Oncology at Indiana University, in particular from Jim Cleary and David Jorgensen, one of the start of the Pain and Policy Studies Group. And I have to say, as you can tell, I don't have the lovely Australian accent like Jim, but so I bring you the hearty and warm greetings and really warm and wonderful congratulations on this incredible event. So when I was thinking about this, it's interesting because what kept coming to mind, the visual that kept coming to mind is the ripple effect of APCA. And it's initially sort of this small pebble that dropped in a pond, right? It's small ripple. And I think Emmanuel and someone else mentioned this, but little did you know that what was happening in terms of your work of building collaborations, empowerment, and emboldening, where the ripples rose to waves in an ocean of pain and waves of relief for millions of Africans. And I'm just going to share one way out of the many, many, many achievements that we've heard today that has led to major improvements in palliative on the African continent and beyond. So just a little bit about the International Pain Policy Fellowship. It is a program that started back in 2006, and it pairs a clinical champion with a high-ranking government official that has the will and the power to be able to make change in their country. And there's a series of trainings that go on, and then the teams are brought together to create action plans. And so I want to just point out, we have the pointer doesn't work, but you'll see on the upper right-hand corner is a 2006 cohort, 2008 cohort in the middle, and 2012. And I have to point out specifically in 2008, you'll see our esteemed Dr. Zippy Ali from Kenya there. And she made tremendous progress, not only in the fellowship and beyond, but as we were, as this was moving along, then I think it was really the inspiration and collaboration with APCA that said, what about having something specifically focused on the African continent? And so that led to Waves of Change for Palliative Care, all because of APCA. It was the first ever African continent-specific African Pain Policy Fellowship. And as you can see, the 5 countries that were part of that were Ethiopia, and we have Ghana, and Rwanda, Sudan, and Zambia. And here's just a photo that Dr. Nahla Ghaffar shared with me. So a selfie of them up in the upper left-hand corner, the 5 of them on the left, and then each one, as I mentioned, is paired with a mentor. And besides mentioning Zippy in the cohort, she was also an important mentor for this cohort as well. But I have to say, none of this would have been possible without APCA, because not only did they help co-lead, they actually hosted the conference in Entebbe. That is where these pictures were taken. So, and many, well, actually all of these are change agents now in their countries, on the continent, and beyond. So I just want to, oops, let me put this. So here's examples of some of the successes. It's very small print, but I won't go into too much of it because it's too academic and not appropriate for this venue. But I do want to just highlight the number of accomplishments in terms of opioid distribution system, education and training, accessibility of opioid medicines, prescribing, other factors that were barriers that, again, if it wasn't for the opportunity to come together in Entebbe and really working with APCA as we facilitated that fellowship. But Nahla Ghaffar from Sudan, who is now in Egypt working at the WHO Eastern Mediterranean office, asked me to share this quote. She said, because of APCA co-leading and hosting the African Pain Policy Fellowship, I developed an action plan and we made major improvements in my country of Sudan. Identifying a clinical pharmacist made huge impact. Since then, in the past 10 years, the palliative care unit has been treated differently. And now patients living far away may receive medications for 2 months. This is a huge change, thanks to being an APPF fellow and a special honor and thanks to APCA. Done. So I want to, in closing, I just was also thinking about a poem, and I'm not really poetic, but I love this phrase, and it really does epitomize APCA. The final stanza in the poem says, "To know that even one life has breathed easier because you have lived, that is to have succeeded." And I will say, because of APCA, millions of Africans have breathed easier, and some of them at their last breath, and a breath of respect, a breath of dignity, and waves of relief in the ocean of their pain. And that is the tremendous success of APCA. So I thank you and look forward to another 20 years of incredible progress. So, and really honor you and thank you. So I have the privilege of moving into the introduction of His Excellency Belgian Ambassador Guy Lendo, who is the current Director General of the Belgian Foreign Ministry. Belgium also holds the presidency of the European Union at the moment, and so Ambassador Dope has that capacity too. He's the former Belgian ambassador to Austria, and that also includes ambassador to international organizations. So he did a lot of work with the UNODC, which is the UN Office of Drug and Crime, and he was the former chair on the Commission on Narcotic Drugs. And he was the one that sort of spearheaded the first ever joint call, WHO, UN, INCB joint call to action. But notably, through his work with the UNODC, His Excellency facilitated Belgian funding for projects in Africa administered by APCA. And so as such, His Excellency has utmost respect, huge admiration, and holds APCA in extremely high regard. He's been kind enough to record a couple of videos for us, one in English and one in French. And so with that, we will play the videos of the ambassador, please.
African Palliative Care Association. It is a real pleasure to address your association, and I am truly sorry I cannot be with you in person. First of all, I warmly congratulate you on your impressive work with the most vulnerable patients. You bring relief from suffering, and you give hope to very ill people. Your daily commitment counts among the most noble health tasks, and we are truly grateful for all your efforts. My country, Belgium, has over the last decades consistently been a partner to countries in Africa in order to help them develop health infrastructure and services, including in very remote areas and among deprived populations. Indeed, health has, together with agriculture and good governance, been a top priority of our cooperation with your countries. This year, as Belgium holds the presidency of the European Union, my country has intensified its health commitments. We have urged the European Union to give much more priority to better access to health and to essential medicines. This has been a success as ever more countries in Europe and around the world are focusing more on improving access to quality medication for the people who suffer most. This commitment to better access to quality medication, and especially to controlled substances such as morphine, is a task I have also taken on personally. With the invaluable help of experts like Dr. Barbara Hastie, we are setting up processes, projects, and solutions, which we hope will help you in your daily work. We want to work with international organizations such as the United Nations and the World Health Organization, with governments, with health practitioners, with associations like yourself, but also with families and patients to offer better access to medication and relief from pain. We see you, the African Palliative Care Association, as key partners in this endeavor. Together, we can give hope to patients, relieve their suffering, and improve access to essential medicines. We look forward to working closer together. So let's join forces and fight the scourge of pain and suffering. I wish you every courage, and I thank you for your commitment.
And I think he has one version in French, and then I'll turn it back over.
Chers membres de l'Association africaine de soins palliatifs, c'est un réel plaisir de m'adresser à vous et je regrette de ne pas pouvoir être parmi vous en personne. Tout d'abord, je tiens à vous féliciter très chaleureusement pour le travail impressionnant que vous accomplissez auprès des patients les plus vulnérables. Vous soulagez leur souffrance et vous donnez de l'espoir aux personnes très malades. Votre engagement quotidien compte parmi les tâches les plus nobles dans le domaine de la santé et nous vous sommes vraiment reconnaissants pour tous vos efforts. Au cours des dernières décennies, la Belgique, mon pays, a toujours été un partenaire des pays africains pour les aider à développer des infrastructures et des services de santé, y compris dans des régions très reculées et en faveur des populations les plus démunies. En effet, la santé est, avec l'agriculture et la bonne gouvernance, l'une des principales priorités de notre coopération avec vos pays. En cette année où la Belgique assume la présidence de l'Union européenne, mon pays a intensifié ses engagements en matière de santé. Nous avons demandé à l'Union européenne d'accorder une plus grande priorité à un meilleur accès à la santé et aux médicaments essentiels. Cette démarche a été couronnée de succès puisque de plus en plus de pays en Europe et dans le monde sont conscients de la nécessité d'améliorer l'accès à des médicaments de qualité pour les personnes qui souffrent le plus. Cet engagement en faveur d'un meilleur accès à des médicaments de qualité et notamment à des substances contrôlées telles la morphine est une tâche que je prends moi-même également à cœur très personnellement. Avec l'aide précieuse d'experts comme le docteur Barbara Hesty, nous mettons en place des processus, des projets et des solutions qui, nous l'espérons, vous aideront dans votre travail quotidien. Nous voulons travailler avec des organisations internationales telles que l'ONU et l'OMS, avec les gouvernements, avec les professionnels de la santé, avec des associations comme la vôtre, mais aussi avec les familles et les patients, afin d'offrir un meilleur accès aux médicaments et au soulagement de la douleur. Pour nous, l'Association africaine des soins palliatifs est un partenaire clé dans cette entreprise. Ensemble, nous pouvons donner de l'espoir aux patients, soulager leurs souffrances et améliorer l'accès aux médicaments essentiels. Nous nous réjouissons de travailler plus étroitement ensemble, unissons nos forces et ensemble, luttons contre le fléau de la douleur et de la souffrance. Je vous souhaite plein courage et vous remercie tout particulièrement pour votre engagement.
Thank you, and we look forward to another 20 years.
So we have more than a year to make sure that His Excellency will also be able to give us a message in Afrikaans when we go to Botswana next year. So we'll add Afrikaans to that list. So tonight was just the launch of the 20th celebrations, 20th anniversary celebrations of APCA. And there's still a lot more work to be done with all the events and festivities that will lead up to the conference next year. And none of this is possible without the support of the amazing staff of the African Palliative Care Association, people who have a passion for what they're doing. And I just want to warn people that when Patricia is approaching you, be really careful what you say yes to. Because she has a way of getting out way more out of you than what you've agreed to. But so I'm going to ask Dr. Emmanuel to join me on the stage and introduce the staff. And thereafter, we will have the board chair, Tobekile Finger, to do the vote of thanks. So from my side, thank you very much. This is all they paid me for. Thank you.
Thank you very much, Andre, for that. Whatever we pay him, he brings back into the organization. So we want to thank you very much for that. I want to take this opportunity to welcome the APCA staff. Some are here, others are online. I'll start by introducing Ms. Patricia Batanda, who is the the admin manager and PA to the executive director. So whatever you receive, she comes through her hands. And then I want to introduce David Biaruhanga, who is the chairperson of our organizing committee for these celebrations. David, you need to come near so that people can see you and the camera can see you. David has laid down a very good plan leading up to 2025, and we want to thank you, David, very much for that. Yes. We then have Dr. Eve Namisango, who is joining in from Europe at the APCA meeting. She's our research and programs manager. And those of you who are in the sessions there, you saw some of the the papers that she has written from the African Palliative Care Association. We have Miss Mebo Namudu, who is our finance manager. She's joining us virtually, and she's the person responsible for making sure that the money is properly handled, whatever money we get. We have Eugene Rusanganwa. He's one of the program officers. He's joining in from Kigali, Rwanda. We have Imelda, who is joining in from Nairobi. Imelda is in resource mobilization, and Eugene is one of the program officers. We have Frank Kayondo, who is responsible for moving the CASA remotely. He's like a witch. He's like a witch. I can be in South Africa, he sits in Uganda and tells me do this, and the CASA moves. Now, if you want a better witch doctor, there he is. Thank you very much, Frank. We then have Wezerai. Wezerai juggles Kampala, Johannesburg, Cape Town, and Harare. She's in charge of our communications. We have Diana. Diana supports the research side. She's joining us remotely. We have Vito. Vito is both in security and housekeeping. So is Siraje and Pasco. I hope I've not left out any. Oh, now I was making the biggest mistake. I don't know where I would pass. Then we have Salim Njira, who is our finance and admin assistant. So that's the team at APCA. We are just a team of about 13, 14 people, but you can trust them to move the world. Thank you very much, staff. In a special way, now I want to introduce our chair of the board, who will introduce the other board members. We would not have had all the clout and the connection and the engagement without her support. We want to thank you very much, Toby, for holding the horse by the horns and bringing us to Cape Town. Thank you very much. Oh, you want to take a picture? Thank you.
Thank you. Thank you so much, Emmanuel. I think in our midst from the board, we've got Prof. Ike from Nigeria. Dr. Zipi from Kenya, Nairobi. And Prof. Renee from UCT South Africa. If you see me intelligent, this is the wisdom that I'm surrounded by. I think we've come to the end of the activities, but I think what we want to emphasize is that this is the beginning of the multiple activities that will be taking place leading to Botswana, which is where we will host our international conference. I think it's undeniable that there's significant improvement that we've done in palliative care in the last 20 years, and it is mostly the champions that are in this room that have been working hard in making sure that we move mountains. When I looked at Barbara's side, when he was talking about people swimming in the ocean of pain, it's such an underestimated statement given the pain that most of us we've seen working in hospices. And sometimes people really don't understand where our passion comes from, because palliative care is the most underfunded and under-resourced program over the world. I don't think it's just in the African continent, and how we have sustained the work is through the commitment and the passion of people that we have. We truly work with less in palliative care. We really know how to maximize resources and technical resources across the globe, where we use each and every individual across countries to be able to advance the work that we do. Today, I really want to honor the patients and families that we work with. Without them, none of us would be in this room, and we really want to recognize them and thank them. Let me come to all the champions that are championing palliative care. We can't mention them by name, but across the African continent, we've got multiple champions that continue to deliver palliative care, including the speakers today. I think we've seen a fraction of those champions. As the video for Kath was playing, I think I became a little bit emotional. Like Andre was saying, she had so much impact to so many of us. And every time when you were in her midst, you would think you were unique and special, because for each and every individual that she came across, you were special in that manner to her. Equally, for most of us that are in Uganda most of the time, you can never leave Uganda without going to Prof. N's house, where she would host us. Old as she is, she still has the compassion, the kindness to be able to host everyone that is coming, and you would be nervous on her behalf in terms of how is she going to accommodate us. But she finds a way, and I don't think there's anyone in this room that's ever been to Uganda that has not been in her house with her kids and with multiple people in the house. I mean, every time when you go, there are various people that are living in her house. And for me, that is the true passion of the champions that are working in palliative care. Without the donors, we won't mention them by name. I think Emmanuel did a good job of mentioning all of them. We appreciate the funding that we get. And I think have had multiple discussions today on how we want to diversify ourselves in understanding that the gap in terms of funding is so limited. We understand that there is no funding for palliative care, and the question is, where is that pocket of funds in terms of how we are going to continue our work? There are multiple stakeholders that we work with across the continent. We really recognize them. Andre, thank you so much for moving the program today. We always grateful for the support that we do. And I think lastly, in absentia, we would like to thank the Deputy Minister. He was here from 5 o'clock. He's never been late to most of the events that we host. He was here from 5 o'clock. We were able to engage him while he may have been in the room for a few minutes. But I think Prof. Renee and the team, we were able to put across the message. And I think that's the champion that would like to say, championing Southern Africa. Botswana conference is in our borders. And I think we need to lead as Southern Africa to be able to do that. But let's equally honor those that have passed. I think Kath is one of the few There are so many that have passed and that have done great work. And even if we didn't mention them by name, we recognize them. To friends of palliative care that are not in palliative care that are in the room, you now know what it is that we do. I will be putting you on the spot. I will not mention you by name and put you on the spot today, but you were invited to this meeting for a reason, and you know yourself. So I will be chasing you in terms of how you are going to support the work that you do. So there are various doctors in the room today that are serving in Europe, in South Africa, in the US government. So we've invited them strategically to this meeting because we're looking at their pockets. So we are watching you as we leave this meeting. We will engage accordingly. Thank you so much. I wrote this down and I forgot. We've had about 71 or so odd people that were online that were diligently started from the beginning up until the end. It would be prime for me not to say thank you to them. So we really thank you everyone that has joined us online. And to the National Department of Health in terms of the media briefing and releases that they've helped us to do. We also thank them in absentia. I know that the communications director is still around and has been helping us immensely since we started this process. Thank you very much.
So I got one more instruction, and that is to close the meeting. I thought once the chair has spoken, like the minister, no one else speaks. So yeah, just to again, this brings us to the end of our program, but also the beginning of celebrations for the 20th anniversary for the African Palliative Care Association. And I really hope that people will continue to support these events. And all the best to APCA for 20 years. Thank you very much.